My name is Becky Hirst and I'm the Principal Consultant of Becky Hirst Consulting based in Adelaide, South Australia. I'm originally from the southwest of England, a place called Gloucester, where I grew up and began my career in community involvement and community development work, specialising in health promotion. And then I moved to London, where I spent a couple of years working on various different contracts, which I will talk about through the course of this mini film. I then emigrated to Adelaide, Australia a couple of years ago and have loved it ever since I've been here. Decided to set up Becky Hirst Consulting about 9 months ago, and things have been going from strength to strength. My experience of working with culturally and linguistically diverse communities began back in my hometown of Gloucester when I was working for a health promotion department for the local National Health Service. One of my priorities in my role was to target the Southeast Asian women living in inner city Gloucester to promote healthy eating opportunities. The first thing I found that helped me in doing this and to set up some really decent projects was by working in partnership with the local Southeast Asian Women's Association. I found that by making contacts with that organisation, by building respect and learning about the culture, that enabled me to really find a good inroad into providing services for that community. And it really helped in building the credibility of the project. A really exciting piece of work that I did in London was working for the Camden Primary Care Trust, which is in North West London. I worked for the Stop Smoking service there on a 7-month contract, and my job was to promote the Stop Smoking services to the culturally and linguistically diverse populations that had a particularly high prevalence of smoking. Not only was my job to promote the services, but it was actually to identify if we could be setting up any better, more culturally appropriate services for the people of the area. So the first thing I did was obviously identify which those CALD groups were. Now, not many people know, but the highest prevalence of smoking is in the UK is amongst Bangladeshi men. Something like 44%, I think, of Bangladeshi men smoke. And services that are currently provided weren't actually appropriate for their cultural needs. Something we found out as a result of working in partnership with these men was that badminton was a really popular sport amongst that particular community. What we identified with them was that if we were able to offer them a badminton session at the local community centre where they could have a couple of hours playing badminton, an opportunity to get fit, use the gym in those premises as a group of Bangladeshi men, therefore in a safe environment, we could also tack on an opportunity to give up smoking. And the men advised us about this project and suggested that we call this project Quit and Get Fit. Also then discovered that one of the best ways to reach the Bangladeshi population was by a TV channel. The TV channel was called Channel S, and this was broadcast from London across the world to the Bangladeshi population, but with a large proportion of Bangladeshi people living in London, it was a very popular local TV channel. So the men that we worked with recommended that we approach this TV company, and when we did, they were more than happy to help us. We were able to get a slot on their news. We were also able to get a really good deal to promote the group, the Quit and Get Fit group, and also the Stop Smoking helpline. And this actually was a really, really positive way of getting the message out. And I was amazed that a channel that broadcasts from London across the world actually had such a local following.
উৎসাহিত করতে কাজ করে যাচ্ছে বেশ কিছু প্রকল্প। তেমনই একটি প্রকল্প হচ্ছে Quit and Get Fit project.
Offering advice, he'll offer nicotine replacement therapy, so the patches or inhalators or gum on prescription, so he can offer that as well as ongoing support and advice. And something else we also do is measure people's carbon monoxide levels, so we'll be able to tell them how much carbon monoxide is in their system when they're smoking, and then when they give up smoking, it drops
on that news show, I was suddenly being approached by people in the Bengali community saying, hey, it's you, can I, how do I get to this stop smoking service? I did a piece of work for a council in the western suburbs in Adelaide where we were consulting on a community plan that was being written to provide a vision for the city until 2020. And there were numerous different ways, numerous different things we were doing to involve the community in this process. But of course we wanted to involve the local CALD population, and there were different things in place for that, and particularly we wanted to hear from young people from culturally linguistically diverse communities. A brilliant thing we did was we went to the Adelaide Secondary School of English, where we were able to go and meet with the student council. I've never seen such a student council, probably about 40 students in the room, all extremely keen to have their say, all very new to learning English but were great at communicating with us about their needs and their wants. One of the groups in that session was a small group of young Afghani girls, probably about age 12-13, who'd moved in the last year or so from Afghanistan. These young girls were very happy with where they were living now and found the process of providing input to council decision making extremely challenging. It's not something they were used to in their society that they come from, and quite frankly they were very happy with where they were at now and couldn't think of ways to make any more improvements. What we were able to do obviously was take the things that they liked about the city and provide that into the plan. So for example, in 2020 their vision was that you'd still be able to play out in the streets safely, you'd still be able to walk down the street without feeling intimidated. So it was a really great experience.